Bolo. Yeah. Hello, I'm Dr. X, doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Emma Watson, and I'm 28 years.
Okay, how may I address you?
Please call me Emma.
Okay, Miss Emma, today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
During our discussion, I might take down some notes, which will be strictly confidential. Is that okay?
Okay.
Okay, well, Miss Emma, can you please tell me in your own words what have brought you here today?
Sorry, doctor. I am having severe headache, and this headache I haven't ever felt in my life. That started around 2 days back. I went on a night party with my friends.
Okay,
Truly speaking, doctor, I took some cannabis and some amphetamine tablets at that party. I hadn't a problem when I was at party, but after coming back my home, I noticed sudden severe pain on my head. I had migraine before. For that, I took paracetamol, ibuprofen, like two
okay,
dose, but that didn't help me much. I thought that it is something very serious, and I took a large dose of paracetamol that helped me a little, but that is not sufficient for me. I am suffering for that, and for this, I visited my GP, and he sent me here.
okay. I am very sorry to hear. I will try my level best to find out the cause. Can you please tell me that which side of the head is the pain? Is it whole
Mostly
head,
on my back of
just
my head, and
back of
I
your head?
think I
Okay,
think it's
well,
all over my head, but mostly on back of my head.
okay. Can you please tell me that did this headache come along suddenly or gradually?
Suddenly, doctor,
Suddenly. And may I know for how long have this been present? Or for the 2 days continuously, or just it
yes,
this
yes,
come and
doctor.
go
For 2 days,
continuously?
just taking paracetamol is helping a little, but not so much.
Okay, okay. Well, can you please describe the how does the pain feel? Can you describe it for me? The pattern of the pain,
I
throbbing
that
or
it
something like.
is not throbbing.
Okay. Is it throbbing?
Yes.
Okay. And can you please tell me that does that pain go to anywhere else or just stays there in the back of the head?
Back of the head, only on the back of the head.
Okay. And if I tell you that 0 is no pain and 10 is the highest pain that you can feel, then how will you rate this pain?
I will say it is 7 to 8.
7 to 8. Okay, I get it. And well, have you felt that is there anything that makes it you feel better or worse?
Such taking some paracetamol just helped me, but nothing more.
Okay. Anything that makes it worse?
No, I cannot tell.
Okay. And okay, and may I ask you some questions now? Well, before this headache started, did you have any trauma to your head?
No,
Okay. Any raised temperature?
no,
Any difficulties in your neck movement?
no,
Any rashes anywhere in the body?
no,
Okay. Any difficulty in speech or swallowing?
no,
Any okay? Any weakness in any part of the body or any abnormal sensation?
no abnormal sensation. I feel somewhat dizzy when I stand up from the
For
seat
how long?
for last 2 days.
Oh, for last 2 days. Okay. For last 2 days. Okay. And may I know that do you have any joint pain?
No,
Any any rashes?
no,
Okay. And what about your okay? And what about your water work?
it's just like before.
Okay. And any chest pain?
No,
Any racing and pacing?
no,
Any shortness of breath?
no,
Any chest tightness or noisy chest?
No,
What about your bowel movement?
it's okay.
Okay, well, may I ask you some personal questions? Are you on any pill for any contraception or something like that?
Yes, doctor.
May I know for how long have you been taking this?
For last 8 years.
Okay. And well, you told that you have migraine. Well, did your GP detail that anything about this pill? Since you have migraine, sometimes there is some association. Did he ever tell you?
No, I haven't heard anything from
Okay,
anyone. I
okay,
just
okay,
take them
okay,
from.
okay. Yes, again, some personal question. Well, how about your menses? Is that all right?
Yes, doctor.
Okay. Well, may I know that it's another personal question. Whom do you live with?
Living with my boyfriend.
Okay, and may I know that have you ever tried to be pregnant?
No,
Okay, okay, that's all right. And may I ask you some other questions that you told that you had a migraine previously. For how long had you had migraine?
for about 6 years.
Okay, and have you been on any medication other than paracetamol for this migraine?
Ibuprofen
Ibuprofen for how long?
for last 6 years.
Okay, and any recent changes in the dose?
No, just when I feel that
Uh,
pain, I just take paracetamol
okay,
1 gram and one ibuprofen tablet.
okay, well, okay, and that's all right. And may I know that do you have any other health condition other than migraine?
No,
Okay, and okay, and are you allergic to any medication?
no,
Any over-the-counter medication?
no.
And you said that you took some recreational medication. May I know how often do you take this? It's a personal question, but it's important.
Only on when I am on parties, not regularly.
Okay, okay. And may I know that how much do you take and by which route?
Okay, doctor, I am vitamin by uh, inhalation, cannabis
Okay, okay,
as a smoke.
okay, I get it. And may I ask you some personal question? Do you smoke?
Yes, doctor.
How many sticks for how year? How many years?
About 10 sticks per day for about 10
Okay, for how
years.
many years?
10 years.
Okay, actually, it's very harmful for your health, and it would be better if you quit smoking. If you want, we can refer you to the smoking cessation clinic. Is that all right?
Okay,
What about alcohol? Do you drink alcohol?
occasionally.
Okay. May I know, is there any binge drinking?
Sometimes.
Okay. And okay. And yes. And I actually binge drinking is also very harmful for your health. It would be better if you cut down your alcohol consumption. Will that be okay? If you need
Okay.
help, we can involve the social services. Is that okay?
Okay.
Okay. And may I know that uh, um, uh, may I know? Well, I have some question. May I know that do you feel any pain in your neck?
No,
Okay. And may I know that what do you do for a living?
I work at a pharmacy.
Okay. And well, how have been the last 2 days? Have you been able to go to the pharmacy for work?
No, doctor, the pain is so severe. I couldn't attend my job.
Yeah, yeah, yeah. And do you drive? No.
No,
Okay, that's all right. And may I know what your concern is?
why I am having this, doctor? This is something new to me.
Yeah, I can get it. Well, actually, at this point, it's a bit difficult to be completely sure about your symptoms. But at first, we will have to examine you and assess you properly, and then we can give you a much better explanation. However, as long as we have taken your history, I think that you might be suffering from a condition named subarachnoid hemorrhage. Okay, this can occur when this can occur when so in some people who take this recreational medications actually. So we are not sure at this moment. We might have to do some scan. We will have to involve the jaw nerve doctor. and we might do some scan, and it might be necessary. It might be important necessary to uh, take some fluid from your spine as well. We will get to. We will. It will actually depend on the specialist jurisdiction, and actually we will also you will also need to cut down your alcohol consumption, and you will also have to need to stop your recreational medication intake. And however, if once we confirm what we are suspecting, we might give you some medication. Are you getting me?
Yes, doctor.
And in the meantime, so that you do not get deteriorated, uh, we might keep you. We would like to keep you under close observation. Is that okay?
Okay.
Do you have any more concerns?
I couldn't get that. What did you say my diagnosis?
Yeah. Actually, it's don't bother about the term. It's actually called subarachnoid hemorrhage. This is sometimes the blood channels that are present in your brain. Sometimes it can they can bleed out. Okay, it can occur when you take some recreational medication. So we are not completely sure at this point that whether it's the cause or not, but we are suspecting this. So we are going to run some blood tests, some scanning, and also some fluid we may take out from your spine, but it will all depend upon the specialist opinion. Are you getting me?
Okay.
Do you have any more concerns or questions?
Are you going to give me any medication? This headache is severe, doctor.
Yeah, I will consult with your consultant that whether we can give you some medication for the time being. But I'm afraid that this might not be the definitive treatment. Okay, at first we will have to find out the real cause. Then we can be more confident about the treatment. Are you getting me?
Okay.
Any more concerns?
No, doctor. Thank you.
Okay, okay.
So, what is your diagnosis?
Well, I think that after evaluating the patient and looking into the symptoms, I think it's more probably due to subarachnoid hemorrhage, due to most probably having some arteriovenous malformation. I think, okay, which ruptured due to taking recreational medication.
Now, what are the risk factors for subarachnoid hemorrhage? Can you?
Uh, any aneurysms, I think, coarctation of the aorta. Then I think polycystic kidney disease. Then I think any arteriovenous malformation, any hypertension, I think, and also recreational medication intake.
For
I think
polycystic kidney disease, have you asked the patient about her family history?
oh no, sorry. I just forgot to ask the family history. Sorry. Yes. It must have been asked. I just totally forgot the family history, I think.
Yeah. And can it be due to any NAS,
Yeah, sorry.
any clotting in the blood vessel?
Yeah, I didn't ask, I think. I asked about period pregnancy, but I didn't tell about ask about clotting.
Okay. So, how will you investigate her?
And some routine blood tests, CBC, CRP, etc. And also, I think we will go for CT scan of head, and if needed, lumbar puncture can also be done, I think. And
Sudden onset of headache. What are the differential do you have?
I think for sudden onset headache, I think uh, yes, I think it can be uh, subarachnoid hemorrhage. It can be due to any trauma, subdural or extradural hematoma. Then also it can be cerebral venous sinus thrombosis, and Organosis, thrombosis, and others I cannot just remember at this moment.
Okay, as this patient had history of taking recreational drugs, there is also possibility of head trauma. She may not remember that.
Well, I asked actually, but
I'm sure she also have a history of binge drinking.
yeah, I asked about
Yeah.
some head trauma. Actually, she refused.
Yes. How will you manage her if it is a case of subarachnoid hemorrhage?
Well, if it's a case of a subarachnoid hemorrhage, I think I will have to do give him some medication like nimodipine, okay, 60 milligrams 6 times, and also I will have to take neurosurgical opinion, and they will decide whether any platinum coiling or clipping will be necessary for the patient or not.
For her headache.
Yes, and I also have to give would like to give some analgesic.
What type of analysis?
Uh, I'm not sure at this phase, but I think it might be opioid. I'm not sure. I'm sorry.
Okay, that is not a problem. Maybe your diagnosis history takings, that was fine.
Okay, but I missed a very important point: family history.
Family
I
history.
just forgot it.
Others, lady has important family history. You missed it. Otherwise, everything was
Just
fine. And also, at asking the patient, that patient has severe headache. So you could have offered her that will we continue this conversation or do you need to take any medication for headache?
okay,
Patient have severe headache. With headache,
okay,
she may not comply with you.
okay, 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 okay.
After those, everything was fine. Okay, thank you.
Okay, well, what analgesic can be given here? Opioid or paracetamol?
Paracetamol.
Uh,
Opioids are
I
not
also,
central acting.
yeah, I also thought about, but I was just got nervous. So, okay, okay. So I think that's all for today. Am I all right?
Okay, bye.
Okay, bye.